And Karen is going to talk about successfully using this in the home where she's the matron.
Monkston House is a 41-bedded home made up of mainly clients with specialist dementia needs. Initially, we were asked to take part in a pilot scheme with working with Sue and Swansea University to develop the profile, and consequently we've been now running the profile for the last 5 years. During that time, we have been able to greatly reduce the dose, and in most cases clients have actually been antipsychotics have been discontinued. It starts with the initial assessment, so when we've used the profile as part of the admission assessment. So when somebody comes into Monkston House, we go through the profile. As you can see, I think there's a copy on everybody's table, or what we go through, the vital signs, observations, history, that type of thing. It's then reviewed on a monthly process as part of the care plan. We use it in conjunction with the MAR chart. It does take initially a little while to set up, but like I say, we include it in the assessment, in the admission process. Once it's up and running, it doesn't take long to fill in, and we use it with the MAR chart. So as you would fill in the MAR chart, you would fill in the profile. Like I said, over the last 5 years, it has made a great difference to our clients. It's improved the well-being of the clients. We've reduced admissions to A&E. We've had a big reduction in fractures. And it's really improved the well-being of the clients, and not only that, it's given the staff the information, because they're completing the profile. They've got the evidence, the documentation, which enables them to take part in decision-making with the multidisciplinary team. It's also given the staff the confidence with that knowledge and documentation that they have to challenge GPs when they are prescribing these drugs. Obviously, we have got that information in the profile, the document, the information is there, so that you can challenge, that these drugs are not really having the desired effect. And what we have found throughout the 5 years that we've been doing the research is that the advantages of the drug are not as great as the risks. The risks far outweigh. We've had clients that have, by using the profile, has identified other health problems like underactive thyroid. By sort of looking at the profile, we've been able to reduce the dosage, the administration times. An example with risperidone, people come in to us, and mostly risperidone is prescribed at night. We find that it keeps them awake. We give it now in the morning. That's had a much better effect. And I think where psychotics are useful in the transition period, lots of clients at home are prescribed antipsychotics that are more manageable. I think they can be of benefit in the transition period while they come into a home. But because of all the other adverse effects that they have, mobility, all the other things which are in the information, and obviously I can answer any questions anybody would have afterwards, the actual risks of taking them is not, the benefit is not there, and we have found that during our research with Sue. And as well as it's improved the staff's self-esteem, and that they feel that they are actually contributing and that they are, making a difference to these people's quality of lives. And it has been a huge success in our home.